I welcome you all to episode 7 of Verbl Phyisio. I am Dr. Sudarshan, and my 4 questions for today are: I have a patient who wants to know that I'm suffering from shoulder pain for the last 3 weeks, and when should I really stop the therapy because I'm feeling better now, but I am diabetic, and what is the ideal time to stop my therapy? I also have a patient who wants to know who's suffering from neck pain and what is the ideal form of pillow that I should be using in order to get rid of the neck stiffness and pain that I develop in the morning time. Then I have someone who's suffering from COVID in the month of April. She's recovered completely but now has some multi-joint pain. Now she wants to know, will she ever get rid of this pain, or will this persist throughout her life? And the last question is from a runner who wants to know that he's suffering from some kind of pain in the knee and what this is exactly all about, and what should he exactly do. Should he stop running, or should he consult a specialist, or can he do something at this point of time? So thank you so much all for writing in, and before we start, I would like to thank you all for the response that we are getting on Verbl Phyisio. We have people watching us on YouTube, social media, and all the other places, and make sure you subscribe our channel so that you can get a notification whenever we come across the next episodes. We have our episodes on regular Thursdays, and make sure that you actually subscribe to our channel. And we have been getting a lot of views on Facebook and Instagram also, where these episodes are available. So thank you so much for writing in. And for people who are watching us for the first time, if you are suffering from any injury, whether you're a runner or a cyclist or a fitness enthusiast, and if you have any questions related to your injuries, or for me as a physiotherapist, I'll be more than happy to answer all your questions. Here is the link to the question. It is drsudarshan.co/question. You can put in your question, write it in detail so that I can answer your question in the upcoming episode, and I'll be more than happy to help you there. Thank you so much, and let's move on to our first question for the day. So the first question is from Naveen Sharma from Jodhpur. His question is: I am a diabetic and I have been treated for shoulder pain for the last 3 weeks. Now I have pain only while raising my hand in the end. So can I continue these exercises at home? Hi Naveen Sharma, and thank you so much for writing in. Firstly, a diabetic shoulder is something which takes a long time comparatively to a normal shoulder. If you have been doing therapy all this while, I'm sure your range would have got better by now, and the pain would have reduced to quite a good extent if it is almost for 3 weeks, right? So but then the thing is that if you still feel that there is still a pain in the end range of motion, which is like, if you find that it is difficult for you to move your hand in this position and in this position, then I would suggest you to continue therapy and make sure that you strengthen your muscles, because shoulder is a very it's an amazing joint in the human body. It moves across all the directions, but then because of this it has a high chances of having injuries on a regular basis. And this is not really an injury, but I would say more of a wear and tear, which happens essentially in the cartilage and the muscles of the shoulder joint. Now we want the muscles and cartilage to rework and get repaired a bit so that it can take care of the shoulder for the coming years. Now for this to happen, it is very important that we strengthen the shoulder. Okay, as long as we do not strengthen the shoulder, make sure that it reaches the end range of motion also, and ensure that it is absolutely pain free. As long as you don't see that your shoulder is completely pain-free in all directions, including rotation, it's very important that you continue your therapy. Sometimes shoulder does take a long time, specifically in diabetics. But then there is nothing to worry about. All you can do is just continue with the therapy. Maybe you can reduce the frequency of therapy and do a lot of exercise at home also, but don't stop the therapy abruptly. Okay, make sure you continue with the therapy, because otherwise there are high chances of you having this shoulder problem once again. So to avoid this, make sure that you continue the therapy. Thank you so much for putting in your question, and I hope I have answered your question. So the next question is from Minakshi Khote, who's from Kalyan, and she wants to know what is the ideal support or the pillow required in order to sleep or support the neck while sleeping. I've been trying to use different type of pillow, but my pain and stiffness in the neck still persist. Thank you, Minakshi, for writing in. And this is a very common question that has come across for my patients also, where a lot of patients who have neck pain keep asking this question: what is the ideal form of pillow, and how should we use it? What is the consistency here? So let me tell you, ideal pillow would be something where yeah, I have a picture for you. Yeah, so this is what an ideal pillow would look like, okay, where you have a support for your head as well as you have a support for your neck, the smaller area, and then while it should also have a good width, because let's say when you're sleeping sideways, so it should also be able to support your neck on the sides. So that's very important, that it supports your neck on the sides when you're sleeping on the sides area. Now talking about the consistency, essentially a lot of people use very soft pillows, okay, which actually doesn't give any support, and a lot of time people use very hard pillows that also keeps your neck in a very stiff position. So ideally a pillow should have a medium consistency, wherein you are able to use your neck, you're able to support your neck in certain directions, and it gives you the kind of support required throughout the night for you to sleep. A lot of patients still ask me that, if is it okay to avoid using pillows? Well, if it supports your neck in the right way, if your body gets used to it, because a lot of time body has its own natural tendency to get used to, even if you're not using the pillow. For example, if you're just sleeping on a flat surface, so it does help most of the time. But in case you have any issues and if it doesn't support you, then probably using a pillow is better. So this is what an ideal pillow would look like: a medium consistency and a proper width covering your head, neck, and the sideways. So thank you so much, Minakshi, once again for putting up this question. And moving on to the next question. Well, our third question is from Nandini Pawar. She's from Thane, and she wants to know: I was diagnosed with COVID in April 2020. Though I am fully recovered now, I have been suffering from multiple joint pain, for which the doctor has advised me physiotherapy. Will this be a lifelong problem for me, or can I get rid of it? Thank you so much, Nandini, for writing in. And yes, this multi-joint pain looks more like a post-viral issue which has come to you, and this is very commonly seen with viral fevers, or sometimes even with rheumatic fever, which actually releases the rheumatoid arthritis issue. Now this classically happens after a certain form of inflammation, and whether it will persist or not, it will completely depend on your immunity. Okay, if you have the right kind of immunity, it should not bother you. Okay, but yes, if I have to talk to you about how do you protect your joints in presently and in the coming years, try and keep yourself as much mobile as possible. Right now, since you have an inflamed joint where basically even doing a little bit of movement is causing pain for you, what I would suggest is you should actually look out more for non-weight bearing exercises. You should look out for exercises wherein you are doing it without standing, or probably avoid too much of walking. Try and get into those exercise form where you don't have to put all your weight on your knees, because right now, because it is inflamed, there are high chances that pain can again get worse. Okay, so better options would be going on with some basic form of exercises which you can do in sitting, which you can do in lying down, which you can do in on a ball, or probably even if you have access to swimming pools, if you can try and do these exercises in swimming pools. These are also an amazing form of workouts where your joints don't have to take the load. So if you just manage this whole your position of your joint position at this point of time and help to improve your mobility, hopefully you should completely get rid of this. Okay, and whether it will persist or no, it will depend on your immunity. How is your immunity overall. If you have a good immunity, it should not disturb you, because it is more like an autoimmune issue. And if you take care of your health, if you take care of your immunity, and if you take care of your overall body by taking proper supplements, it should hopefully not come back to you. Thank you so much for putting up the question, and I hope I have answered your question. Moving on to the next question. So the last question of the day is from Radhika Singh, who's from Delhi, and she wants to know, I'm a runner and I've been witnessing a dull ache around my kneecap, and there are also some sound when I move my knee in full range of motion. So do I really need to stop running and consult a specialist? Well, Radhika, you don't have to really stop running for this, but from what you have been telling, this looks more like a runner's knee, or what we call a patellofemoral pain syndrome, okay, wherein typically you get this pain around the knee joint, specifically when you are running or post run. So ideally what I would suggest you to do is maybe get to something what we call the RICE therapy, okay, which is basically rest for a certain span of time. Let's rest out the knee, okay. Do a lot of icing to this knee area post your run. You can also do the icing post run. Compression, maybe by just tying up a bandage, a crepe bandage kind of thing around the knee area, which can help and elevate your knee. That's something which is very important in an extended position. Make sure you include stretches in your regime when you after your runs, because if you have not been doing stretches, there are high chances that your muscles get very, very tight, and this could also increase the pain around the patellar area. Now if you say that you have to stop running for this time, as long as the pain is in a scale of 2 to 3, okay, like if I give you a scale of 1 to 10, and if you rate this pain as 2 to 3, then you don't really have to stop running, but continue your RICE therapy, okay. And if you feel that there is swelling and good amount of pain where it is a little unbearable, then probably you should stop running and consult your orthopedician or your physio and check out what needs to be done. Normally the course of physiotherapy in this case is just checking the tender areas, if we have any tender areas around the knee, and understanding if ultrasound and then eventually a proper strengthening format is required. You could also check out the kind of form that you have, okay, because this is normally runners knee developed when you suddenly stretch your mileage, or you have been running consistently too much on a daily basis. This could also lead to runner's knee where there is an imbalance between your training and your stretching format. So if that's the case, probably you need to work on your training form and try to see what changes you can do there. So I hope I have answered your question, Radhika. Well, thank you so much for watching this show, friends, and we are on our 7th episode, and we have been getting more and more viewers who are watching this show on a consistent basis. We put up our videos on every Thursday, so make sure you log into our YouTube channel, which is YouTube/Joints in Motion, and you can subscribe to our channel to get a notification for every episode that we get in through. And you can of course put in your questions. I'll be more than happy to answer all your questions. I had put up the link. I'll put this up once again. It is drsudarshan.co/question, where you can put up your link, and I'll be happy to answer all your questions. So thank you so much for watching this show, and see you next week. This is Dr. Sudarshan Singh signing off. Thank you.